very good morning to you and welcome once again to a new day on Signature TV. My name is Godwin Sunday. Today we'll be talking about the state of health in Anambra following the documentary being done by Chimmeli Precious, and we'll try to even find out if there are other angles to the story. But first let me bring her up and to welcome you officially to Signature TV. Chimmeli.
Thank you
Hope
very
I got that
much.
correctly.
Yes, kind of.
All
Yes, you
right,
did.
so let's even talk about your documentary. It was
Okay.
played way before now. What inspired you to embark on the documentary project?
Okay, so personally, I'm someone who likes to go into health, talk about health, I like to have conversations about health. Mostly, it used to be just mental health. But am I allowed to say how
Oh,
I
go ahead, please.
started,
You can go ahead.
the whole... So I was working in a media house way back in the East in Anambra State, actually, a government media house. And, the governor was doing a lot of things, doing certain things here and there. And then I felt the need to bring to his notice certain places that maybe he didn't know about or he couldn't reach or something, because most of his renovations or works were in town, and I was wondering about the villages and rural areas. Unfortunately, for certain reasons, the project couldn't kick off, so I came over to Abuja, and then I traveled to Ogun State for a training, an investigative journalism training, and the project came back up in my mind, and I said, since I already have this platform, I could as well use it to help the people of my state. So that was just it, long and short.
But then Anambra is confronted with a lot of challenge.
Yes.
Why did you pick the health sector as your focus?
Well, health is wealth. That's one major thing. I feel like if there are no healthy people in the state, then we can't even start to talk about other projects. Most times, a lot of issues that are confronted by people in rural areas boil down to their health. If there's no clean water, there's no good health. If there's no good food, there's no good health. So, and mostly I focused on women and children because maternity health as well is very, very important, and it's something that a lot of people in rural areas tend to overlook. I mean, it's just pregnancy now, it's just childbirth, it's just this, it's just this. So a lot of people don't really think about it. People that do not have the means to go to teaching hospitals or private hospitals, they decide to stay at home and do certain things and all of that until it gets worse, and then you expect the doctors to perform magic. So if the clinics or the primary health care centers in the rural areas are not efficient, that means there's going to be a lot of mortality rate in that area. So
Amazing. But looking at the documentary, I saw it, I've watched it a couple of times, and one thing keeps striking for me, because the 15 minutes seemed not to be enough to even say what's going on, because I think most of those women want to express themselves. But you were in the field, so tell us what's the health and facilities and health sector all about? Give us a raw fact on that.
okay, so talking about these rural areas, I was only able to showcase 6 primary health care centers out of a lot in the rural areas. There were even places I couldn't access because you needed to, use a boat to cross over and all of that. And I had to shoot in such a short time because I'm based here, and I had to put work on hold and go over there to, do all of that. So being in the field, there are a lot of things that I did not put on camera, I would say, something like that, because part of the period I was having discussions with these people, and sometimes some of them did not want to say certain things so that it won't look like, oh, we are attacking, but this is exactly what is going on. And I recorded this last year. It's exactly a year. I recorded it in October last year. So out there in the field, trust me, it's worse than what I actually showed here. Speaking about, okay, since I was talking about maternal health, most labor rooms were terrible. That's the the list I can say. If you notice, one of the first interviewee, the doctor, she talked about light source, and if you notice, I had to like put a light on the candle right there just to show. And behind the scenes, she was telling us, oh, we use candles, we use phone torchlights. This is how we are able to, you know, bring these women to deliver their babies. She was talking about a lot of issues. I went around, you know, saw a lot of things. Even my cameraman was like, oh, God forbid anything brings me to these places. That's how terrible it was. It was really bad.
You won't get malaria at that point.
Honestly, he said no. And when he saw the labor rooms, he was like, my wife would never. I said, but there are people come in here, a lot of people, they come in, they have their wives delivered, they don't have a choice. They come in, this is their only hope, you know, for good health, and they don't have a choice. You have a choice. You can say, oh, I'm not going to come to this place because, you know, it's subpar, but there are people who this is their saving grace. So, and yes, and there were some others who did not actually want to talk. You know, they said, oh, it's okay, because actually some people have taken huge advantage of these people. They go out, they take pictures, they make videos, they interview them, they disappear. So most of them, the women, they kept complaining. They kept telling me, I know what you're trying to do is, you know, to get footages, and then you go out and then the government is going to give you a lot of money, or some NGO is going to give you a lot of money, and then you take the videos and you disappear. You're just using us to make money. And I said, no, don't worry. I'm promising you that this is not for me to make money. This is for me to tell the government that something like this is happening. And yes, maybe they did not mean to overlook you, because I mean, the government can be overwhelmed certain times with projects, but I'm going to make sure that they see these things and they do something. So that was it.
Now, speaking of the government, this conversation is very interesting because you've exposed the government of Anambra State, and you've showcased to the world some of the loopholes that they have within the health space. But I'm curious, what has been the government reaction so far after seeing this documentary? Have they been able to react positively or otherwise?
Okay, so a day after the documentary went live, somebody called me. Yeah, somebody called me and said he was a government aide, and then talked about, you know, he tried to tell me, oh, that he wants to know the details of the documentary, that he wants to understand, because that he's surprised that something like this is happening. And I'm like, I had these interviews October last year. So, and talking about the money, the mismanagement fund, if you listen clearly, you would see that it was between, I mentioned it, 2020, 2022, that was when, you know, the money was released to the government. And I made sure you know who was on seats then and who is on seats now. And the people I tried to contact then were the disbursement team of that administration. So, but for the interviews, these were had last year. So he said, oh, that one thing that he wants me to do is for us to have a sequel, actually, that I would be surprised that most of those places have been renovated, some are still being renovated, and he can promise me, you know, that certain things they're going to also look into it, and then the other places that they've not touched, they will make sure to touch it so that I can come back and have a sequel and show that, oh, okay, yes, the government is doing better. So I am hoping that the other places that he saw in the video that they've not touched, they are doing it now. That is what I'm hoping for. And then, because I said, okay, no problem, we're going to sit down and have a conversation and see when we can come over to make a sequel to show that, okay, you people are actually listening and you're doing what the citizens want. So far, I guess it's been positive.
So apart from Anambra State, I'm just curious, apart from Anambra State, have other states also been able to contact you and like, okay, or probably indigenous of other states, have they contacted you to come do similar thing for them also?
Actually, yes. A couple of people, I know some people from Ebonyi State, some from Abia have spoken, and then somebody from Imo actually said so as well. But we have not been able to extend to those places. So for now, I am still talking to them because they're saying, oh, we know this is happening, especially in most states, because at least we know the governor of Abia State is, well, trying to get into certain things. So I've had the person from Imo State has been on my neck. Oh, do you know what? I can help you. I can, be the fixer, find these places. You can come and record, come and show. And then the person from Ebonyi State is also doing the same, for the rural areas and everything. So definitely, I love this project because just like I said earlier, I love health. So if it works out, I would gladly go to those states to showcase some of the issues there in the health sector.
All right, so it is an interesting conversation, but if you look at it from another light, funding for a project of this magnitude is very critical for,
yes,
especially for journalists like both of us. But then, what kind of support did you receive from Women Radio and the MacArthur Foundation?
Okay, so I didn't want to say anything earlier because I knew you were still going to call them so that we don't get into that early now. Exactly. But the Women Radio Center helped me a lot. They helped me a lot throughout. When I went for that training, that was the first kind of intensive investigative training that I have gone for, and I enjoyed every bit of it. The training sessions, the facilitators, and then we had coaches. So I had a coach who put me through everything, the scripting, where you're going to go, have you made contact, have you done this, have you done that, how much is this documentary going to take? At first it was, how do you want to showcase this? Do you want it to be print? Do you want it to be, documentary? How? I told them I want to do a documentary. So now they put me through the documentary process, asked me for the fixer, have you done this? Have you done the research? Have you done this? Is this fact? Is this? Fact check a lot of things. So the Women Radio Center and the MacArthur Foundation actually helped a lot. Took care of the flights, accommodation, payment for everything, the logistics, the cinematographer, the editing, everything. Up until right now, they are still helping. So I am really, really, really grateful. I went for that training, and honestly, if there's an opportunity for them to, still help other states, I am so in. I am in for it, honestly, because just like you said, funding is very, very difficult. And if I'm able to partner up with them and we see this as a long-term project, not just now in the East, different parts of Nigeria, because all through the country we see a lot of issues on social media. People have been bringing things on social media, so now a lot of people's eyes have been opened. So I would really, really want to do in-depth documentary on certain places, certain issues on this same topic. In the heart of Nigeria's southeast lies Anambra State, a land known for its rich cultural heritage and vibrant communities. Known as the light of the nation, it is the 7th most populous state in Nigeria. Anambra thrives in many aspects, but today we turn our attention to an essential pillar of every society, Anambra's primary healthcare centers, PHCs. Anambra, like many other Nigerian states, committed to a vision of accessible and quality healthcare. At every political campaign cycle, politicians drum the promises of perfect healthcare for all the citizens. Once they get into power, they paint the walls of the existing poorly or non-equipped centers, donate a few items like gloves, masks, and they organize the commissioning with pomp and pageantry in the presence of the media. The government of Anambra State in the year 2020 and 2022 received the sum of 813 million naira specifically for primary healthcare development from the Basic Healthcare Provision Fund. According to reports, the account of expenditure shows that only 358 million naira were disbursed to 332 PHCs that were enrolled under the Basic Health Fund for the refurbishment of their facilities. We were unable to track the balance of 454 million naira. And when approached for an interview, the disbursement team declined.
This is my office where we see patients with my colleague and my fellow health workers. So in this my office, this is where I attend to patients. This is my seat and this is my table. In this room also, there's a section where we keep our drugs and our files, patient folders and all. So like this one room now is for the drug dispensing room. Even where we give patients injection is the same room. So we have many things going on in this area. We don't have oxygen, we don't have oxygen cylinder. We don't even have common glucometer to check blood sugar, random blood sugar, and all those things. So sometimes we will be in lack of even needles, 2 meals, 5 meals. We can't even find them here. Even spirits to at least clean patients, swab. We don't have spirits. We improvise with ordinary water. Okay, some patients that may have like indigestion, all these pregnant women, we don't have proper drugs to treat them. We're mixing sodium bicarbonate at least to calm the acidic content of the stomach. So that is the improvisation we normally do here. In our lab, we don't have some equipment to check even ordinary PCV. What we do is we assume. So it's not supposed to be. And this health center is a place we're supposed to have those basic equipment. People come here a lot. They first of all come here before they go to teaching hospital. So we're supposed to have those things here to help us in our medical treatment and care. When you go to our labor room, of course, it's not in a proper labor room condition. We don't even have normal light source. It's not well equipped. The bed is not okay. We don't have water. There's no water running in our tap. Everything is locked. When we want to do something, go and buy water. It doesn't make sense. So a lot of things we don't have in this place. Even thermometer, we don't have thermometer here. The one that we have is even not okay. You keep doing like this, keep doing like thermometer. We workers we keep buying and buying thermometer with our own money, and the government is not doing anything.
I'm a nurse as a volunteer. Sometimes a madu nebe. I na-eji osisi madakaton but when alone na drip. Ọ na-abịakwa ya na anyị need bed abụọ ọmụma. Ọ bụ na gọọmenti emere anyị ebere na anyị need ya. Na ndị mmadụ na-eme complain ya nnukwu, especially anọsa na dakaton. Ọ bụ na onye na-enweta onwe ihe ọzọ esi bụ n'ukwu na-egbuzi mgbu. Ọ bụrụ maka dakaton na anyị abụọ dị esi. Ọzọkwa mmiri na-adị enye anyị nsogbu na wọọlụ.
The challenges I will about number one, we don't have water. We are facing water outside. Not a boom outside. And we don't have generator. In a health center like this, we're supposed to have gen. In case of if NEPA took off their lights. Meanwhile, I had a worker aquaba. I'm with gen, I can use gen. Like I try more in the nights. I use, we go and buy a torch. We use torch when there is no light. But if there is gen, we'll be using gen. Most of our buildings leaking. Our roof is leaking. We need that. Then go to our staff room. That place is totally broke out. It's leaking everywhere. We also lack of security. We don't have security here. Here is a bush. A staff, because we used to sleep here. It's a quarter. Here is going a 24 hours job. We need security. And then we have toilet and bedroom adorable. So in case they are the other go or sink go. So we need toilet and bedroom. They were lacking of staff. We are 2 staff for government worker. The rest, more employ now from my pocket. 3 of them from my pocket. Most of them are cover my salary. Work for because yara na arapia si yara akwụ ya ụgwọ ọ na anyị na-enye kwesị inye ya o weje goro ife maka ihe siri ike na
ofu ọnụ toilet ka anyị nwee ebe ofu toilet ka ndị nurses na-eyuzu ofu toilet ka onye bịa treatment na-eyuzu ofu toilet ka onye bịa ma onye ọbụla arụ na anwụ bịa na-eyuzu de mmiri adịrọ anyị bụ ndị na nọọsụ na-eje ekute mmiri anyị kute mmiri anyị wee mụọ nwa wee mee ihe niile oles ma anyị afụzi ndị anyị connect fa abịa gbeela anyị mmiri anyị need ihe BP anyị need bed anyị need Macintosh anyị need pillowcase and the pillow n'onwe na pillow anyị o mebisibu mmadụ ọzọ
mgbe m bịara ebe a bụ na 2021 ka m bịara ebe so wee fụ na ebe bụ na họọlụ obodo ka a na-anọ were alụ ọlụ a tulu m so ha wepụta na ka eji wee na-alụ ọrụ na health center ebe nwere ebe a na-alụvu before mana na otego aka alụbara ya mana since ahụ alụlọzịa anyị na o nwere onye bidoro elu ọ dịka politician ka emere mgbe wee lụba dị ọrụ mana since ahụ mesịzịa ọlụlọzịa unu anụnwa ha bidoro lụba asị ka ha lụọ ya ka ọ bụrụ health center unu anụnwa anọtegokwa n'aka sị na ọ nọgo 20 years alụbara ya mana aka alụchaghị ya o melụ ndị peshenti ọ bụzịa na o nwere ndị peshenti chọrọ ịbịanụ so mee ha ma mbịaziri na ha si na ebe bụ họọlụ na ọ bụrụ health center ka ọ bụ na onye ihe mebere bịa n'anyasị na o nwere onye ọya afụ ma ọ bụ na o nwere onye ihe mebere ọbịa na-eyife mịafụ na mmadụ nọọsụ nọgide ntaịm ahụ anyị eji wee na luo anyị naba onwezi onye ihe mebere na mgbede anyasị for example ebe 6 ma 7 ma ọ bụ ihe midnight ọbịa o nwere onye ọ na ọ ya enye aka alụsịa ya na ọ ya esokwu mee a na-enwe ọrụ ọfụma ebe a ndị enwegasịa dipatmentị ọbụla na the center ya bụ enwe ebe a na-amụ nwa enwe ebe a na-abụ immunization nwesịa ụmụ ebe a na-emegasị services dị iche iche na ọnya ya enye aka ma staff quarters ome ndị staffụ enwe ebe ha ya na-ebi ọ ya na-eme mgbe ọ na ha bịara enwe afụ na staffụ na ya na mmadụ na ya na-alụ ọrụ mana ọ bụrụ na ha enwere na onwe ụdị etu ọ ya abụ ọdụ dịka etu ebe dọkịta na onwere ka ya abịa lalụwa ebe na ndị na staff na chance adịrị ya ma ọ na onwe kịta onye nwere problem nwee ike si na nọọsụ nwee ike ịbịa lalụ with the patient ha nwee ike na wee monitor the patient alụ ọrụ so na health center na-adụ mma ebe alụọ health center enwee ike staff anọrịa mgbe ọ na obodo ji bịa ọfụ na o nwere onye nọ na nọọsụ nọ steady na-alụ ọrụ n'obodo dam na ya abịa asị na center kpọchiri akpọchi iwu unu n'anya efu na tulu mse enyere anyị onwelo ihe ọ bụ enwelo line ward enwelo consulting room ma waiting room onwelo ma immunization section unu n'anya efu na ọdụrụ nọ na iji ilu hall wee melụ immunization section.
Ọ dị onye health center dị na n'Ọka Ward 2 enweghị accommodation ebe hall ka attach otu so anyị dị ọbụna oyekwe na bụrụ masị chukwu anyị nweta arụọla anyị ọgbọ ya dị anyị so nwekwe na ma wọd maọbụ ebe ihe niile anyị pụtakwu na ebe ha dịka ụlọ ọgwụ ịghọtago bịakwa anyị kama ọfụ ụmụ ihe equipment anyị dịgasị anyị na-edikwa best ndị a bụ ndị anyị ji aka anyị wee mana abịakwu n'ebe nwa ọya dọ na wọd just obere room like this just two bed na abụghị ihe dịdebe ebe a abịakwa anyị dịkwara delivering equipments ụmụakara ngwa eji emedere na anyị dịkwa manpower ya man personnel ndị na-arụ ọrụ workers anyị na-ala akụ ndị workers so ebe as PHC ọrụ ọ kwesịrị ka ọ na-arụ 24-hour service.
The government has shirked in its basic primary healthcare responsibility, which is the first point of contact for the citizens. It is the responsibility of the state government to provide basic health services such as immunization, maternal, child health care, and treatment of common illnesses. The Anambra state government has a policy of free antenatal and free delivery where pregnant women are expected to benefit from. There are signs in most PHCs showing free antenatal services, but the tools for these services are lacking in the healthcare centers.
The state government said the delivery is free. So now we have influx of pregnant women and they will come here and say it is free. But the things that are needed to attend to them, what are we going to do about it? We'll be improvising and be doing the much, because sometimes we even do these things from our pockets. Some patients that are very poor and don't have any means to assist them because we have so many of them like that in this community. You just have to use your money and buy those things.
For now, delivery is free. And antenatal is free too. Almost quite close to where I did that now, that delivery, you need a drip. I just got a drip. But how come they go drug? Like this time, I'm a one person malamia. Ngayotia said Coneba Adrom Cambemba. This is almost 8 months in the bands from doing coffee where Beba was too bish. Cannot stay here. My one have a man I did too much.
I ask, what work is being done to ensure that these primary healthcare facilities are up to standard so that they can properly cater for the pregnant women who genuinely need them? What is being done to ensure that the health workers do not lack sufficient funds, tools, and drugs to enable them carry out their primary tasks of taking care of pregnant women? While regulating the subsidized fees paid by the citizens to the health centers, I ask, how is the government ensuring these centers are functioning based on the service they are meant to provide for the citizens? In my journey into Anambra State, I met and saw firsthand a resolute healthcare team made up of professionals and trainees that are hardworking. They genuinely care. And for me, this is a testament to the strength of a people determined to heal. I urge the government of Anambra State to turn around the deplorable state of its primary healthcare centers and use them to shine light and bring succor to the good of its people.
All right, so let's even talk about this documentary in itself. Do you have a story? Probably do you have a link-up story to this? Probably something that's happened to you before in the primary health care center, or probably you've had experience with a friend that have been disappointed by the Nigerian healthcare center. I'm curious, is there any personal story to research on the primary health care? Because when you talk about it, you seem very passionate about it. You have a story behind this story.
Okay, so I have had issues, not even exactly on primary healthcare center, but certain healthcare facilities in the countries, you know, friends and family complained a lot. But I think one of the major story behind this is my mom is a broadcaster. So growing up, she had this program on radio where people get to calling and talk about what issues they have. Oh, our roads have not been fixed. Oh, there's this big pothole in our area. Oh, we've not had light. My mom would hammer on that topic. People would come in with their stories like, oh, because of the light, you know, I have been losing a lot of things. I've lost business, I've lost this, I've lost that. So my mom would hammer on it. And then probably a few days, a few weeks, they would call back and say thank you because they came in to fix our lights. They're fixing the road, they're doing this, they're doing this. So growing up, I had this, motivation to do something like that. Something that I could do and in a way play a part in helping everybody around me. Now, coming to the healthcare center, I have had someone who went to deliver and, well, there were lots of complications. There were lots of issues and there were certain things that the hospital didn't have, you know, certain things that you would expect, okay, they are supposed to have. And even though the person survived, yes, but it made me realize that a lot of people are fighting for their lives in this, country, especially in the rural areas, because just like the doctor, it was a similar case with what the doctor was saying. They didn't have thermometers, they didn't have syringes, they don't have a proper stethoscope, their labor room is in terrible condition. So that was almost the same thing. They didn't have a lot of things to help the woman. It was more like they were doing a crude delivery, just like every other midwife out there, because they didn't have things. They didn't have water there. Doing the delivery for my friend, they didn't have water. It was very, very difficult. We had to buy bags of water. We had to go into town to buy bags of water to bring in to help. So it was it kind of also solidified that motivation that I had to do this documentary.
Because I was thinking about it, like, okay, this works. So right now we understand that it was born out of something from your mom, and we really need to thank your mom for that particular effort. But then, some of the things that you saw in the rural areas is almost is relative. In most rural communities in Nigeria, is a CFM, the primary healthcare center gets to suffer this particular faith. But so far, the women that you promised that their voices are going to be heard, have you so far reached out to them? Have they reached out to you too in form of appreciation or something?
Okay, so for now, I just spoke to my fixer yesterday, and I told him to go ahead and look at those rural areas and see first, apart from what they are telling me, to see if this is happening. And he said he was going to get back to me by Monday to go around, because we went to like different areas, so he won't be able to cover all those places right now. So I think, well, maybe we, just like the aide said, we could have a sequel to this interview, and then maybe I would have live interviews of them, saying that, okay, this has improved, this has improved, this has improved. So yes.
Yeah, because what I'm asking that is because as you're moving forward to do all the states, they need to have some form of trust in the system that their voices are actually heard. But let's move on to some of the things you saw even in the primary healthcare facilities in those rural communities in Anambra State. You are passionate about getting their voices heard and telling their stories out there. But on the norm, you should also have some personal solutions that you think you can prefer to the government. So if you have opportunity to speak with the government, what would that recommendation be to the government at this point in time?
Okay, so I would first of all say that the government should not take reports and documentaries like this as an attack. Most times they take it as an attack on, what they are doing, on the work they are doing. Oh, you're not looking, we're doing this, we're doing this, we're doing this, They should not take it as an attack. Most of us just want to help out. Most of us just want to show you that there are certain things you're overlooking. And one major thing is that we like to talk about the state government a lot. Once we say government, we're looking at the governor of the state. And I would say that sometimes this falls on other leaders in the community. You have a king, you have a rural head, you have a community leader, you have a local government chairman, you have a senator, you have people representing you. Even councillors, you have a lot of people representing you. What are they doing before we even get to the state governor? What are those people doing? Now, the woman from Isiago local government area, she talked about the fact that the king was helping. I was so impressed. She talked about the fact that the king said, oh, okay, come, let us see what we can do. We don't have money, but we can do something. Somebody volunteered to bring in tiles for the clinic. So things like that. Sometimes we don't have to wait until the governor does something. We don't have to wait and say, oh no, it's the governor's fault. What are the other leaders that are in line before they get to the governor? What are they doing? Because it's just like I have been saying, the governor might have a lot of, they focus mainly on the town, which is not well, exactly proper, but they focus more on the state capitals. Let us improve it so that, you know, when people are passing by or when they are coming in, we see that, oh, the governor is working. But there are other little places that actually make up the whole state. But sometimes it is not the governor's fault if those places are being overlooked, because your councillors, your senators, your representatives are not bringing it to him. They're not doing anything. There are allocations that they could bring into these places and help you. So first of all, it is not an attack on the government. Most of these things are not attacks on the government. Even when the maybe the title of the documentary or the title of the report looks like, oh, the government, what are you doing? It is not an attack. It is meant to bring your eyes to certain places that, yes, you might be missing out on. And then the representatives need to do their job. In this type of situations, I would blame the representatives before I even blame the governor. I would call out the representatives first. What are you doing? Because you're the ears and eyes of these people. You're the one who is going to sit down with the governor. These people do not have one-on-one interactions with the governor of the state. If you know that you cannot sort it out yourself, go and meet the governor and say, sir, you gave me this place to handle, or the people have elected me to handle this area. But the issue is, this is our problem in this area. We need to do this, we need to do this, we need to do this. How are you going to help us? How are we going to bring... Because if these people are okay, you're okay. That's the thing. Because if these people are okay, this is also going into your manifesto. This is going into, you want to come in a second term. What have you done to the people who are going to vote you for second term? It's not just those 50,000 or 100,000 people in the state capital that are going to vote for you. What about the people in the rural areas? What have you done to actually show them that you care, that you see them, and that you understand their pain? So I would first of all blame the representatives before I even go to talk about the governor. So, yes.
Well, with the way you are going and how passionate you are talking right now, probably would need to root for you to go for the position of a chairman in the local government. but then that's on a lighter note.
Yeah.
Apart from this documentary, I also know that Chimmeli has done several jobs, and you are still working on other jobs also. But tell us about some of the works you've done so far, even outside this documentary.
Okay, so I am a filmmaker, and my area of filmmaking is actually social impact. So they're intertwined.
Okay.
Yes. So I like to, earlier I talked about mental health. I like to talk about mental health a lot, because I feel like somehow, just like rural areas, PHCs, people overlook them a lot. People think, oh, you know what, you're one of the popular social media phrases, oh, you're not depressed, you just need money. While I understand that there are certain people who suddenly become depressed because they don't have money, the fact is that you cannot just, you know, throw the depression away because you feel like this person needs money. Money is your problem. So I like to make films that, you know, speak about that. I have a couple of projects that are in post-production. I have one on depression, and you know, I have another on actually a very sensitive topic that, you know, people like to talk about. That is, well, we're working on getting that produced. That is on rape, actually. So we like to talk about issues like this to bring it to people's, you know, knowledge. Okay, this. Sometimes you have to handle this like this. Sometimes you have to handle this like this. Sometimes you have to handle this like this, you know. So that is what I do. And then, you know, apart from the other things, but I am passionate about helping people. There's a new documentary that I'm also trying to work on, that is on sickle cell. So sickle cell anemia, I've had a lot of people around me, you know, who have had that, and I looked at their behaviors, their distinct behaviors, and, you know, health issues as well. So I would like to put that together and then, you know, see, because a lot of people also mistake certain things about people who live with sickle cell anemia. So
in terms of spirituality?
Yes, sometimes in terms of spirituality, and then sometimes behavioral traits. You know, there are people who have to be in the hospital 25 days out of 30. There are people who go to the hospital once in 6 months. There are people who are very feeble, and there are people who seem very strong. There are people who have been disabled by it, and there are people who are well able, and then you're wondering how come you are all suffering from the same thing, you know. So I want to look at that from the health perspective, you know, from some of the myths and some of the angles that ordinary people look at it, and then from the angles of these people. So
Chimmeli, on a final note,
yes,
something caught my attention in the documentary.
Yes.
And that is the fact that most of the people you spoke to in the course of the documentary are females, majority of them, and it caught my attention. I was like, is it only female that go to primary health care? So was this a deliberate bias on the men or the male folks? So let me get you, because I need that clarification. You on air. So,
do you feel sidelined?
No, let's just,
you were not properly represented.
Let's solve that issue. Because the documentary, we are only seeing only females. So let's get that out, please. Why just females?
So it was an unplanned coincidence. It was well unplanned. I think I did not even notice that until the post-production. I was like, wait, this is
because when I've seen the documentary.
Yes.
Chimmeli deliberately took out the male folks from the documentary. What did we do to her?
No, I did not do that on purpose. I think so. Most of the people, all the primary healthcare centers we went to, even the ones that we didn't get to interview, had female employees,
including doctors.
Now the funny thing is, they were actually just it was just one place that had a doctor. That was Dr. Imelda. That was the only place. Every other place had a nurse or volunteers. So there were no, you know, doctors, a lot of them. It was just Dr. Imelda that was there. So, and then I think we already know the way that our society or rural society looks at male nurses. So I think that might have played a part somehow, because I mean, you're a guy and you're going to study nursing in a rural, you know, environment, and then you come out and you're working in a primary health care. They're looking at you like, are you sure you are in the right line of business, you know, talking about rural communities. So I think that played a huge part, and because of the fact that there were not a lot of doctors, I think that was, so don't worry, we did not sideline you.
Don't worry, I will talk to the men, I will talk to my colleagues, to mail please forgive her. She didn't do
please
it on
forgive
purpose.
me.
It wasn't on purpose, but we want to say thank you so much for coming to Signature TV.
Thank you very much.
We hope to see more report and more documentaries out there, more impact-driven documentary, just like the one you did, because that was something to go on with.
Thank you very much. Thank you very much for having me. It's been a pleasure.
Well, this is how far we can go today. I want to say thank you for watching New Day today on Signature TV. Till I come your way again, same times. I am Godwin Sunday. Enjoy the rest of your day.